Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of July 31st, 2023. After a brief COVID status update, I'll talk about children and COVID, especially in anticipation of school starting soon. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Starting with variant proportions, we can see that we are dealing with all XBB subvariants of Omicron. Even the EG.5 is actually just a nickname for XBB.1.9.2.5, so still in the XBB family. And we're definitely hoping it stays that way because the fall booster, which we expect in late September, is being developed against XBB. Taking a look at the COVID data tracker, unfortunately, we are currently seeing an upward trend in hospitalizations. We can see that for the week ending July 22nd. There was more than a 12% increase in the number of people hospitalized with COVID. You can see this a little more clearly here, where each blue bar represents currently hospitalized people per week, which we can see is creeping up. And for the week ending July 22nd, there were over 6,000 people hospitalized with COVID-19. Unfortunately, we can also see that emergency department visits continue to tick up, and this is a more updated metric, a more recently updated metric, and it's also an earlier metric. So we don't like to see what is sort of a leading indicator continuing to go up. We will be happy when we see this level off or come down, but we can see that through July 28th, there's a steady increase of emergency department visit proportion being attributed to COVID-19. Another early indicator that we've talked about here is percent positivity of tests, although it's getting more difficult to keep a handle on that because fewer tests are being done, but still looking at percentages can give us an idea of the direction things are going, and we can look nationwide to give us a sense overall.
Taking a look at percent positivity, where the darker green is less than 5% positivity. We can see that over the past 4 weeks, a good portion of the country was less than 5%, where the majority was between 5 to 10%, which is that brighter green, not the most intuitive colors here. When we look at the past 2 weeks, we can see that even more of the country is 5 to 10%. The vast majority of the country is at 5 to 10% positivity. So that's an increase. And if we look at just the past week, now we see that a good portion of the southwest area of the United States is actually now between 10 to 15% test positivity. So certainly heading in the wrong direction as it relates to test positivity.
Now, in your area, your county may still be maintaining these data, or perhaps you may have a CVS or a Walgreens tracker that's active near you. Here in Alameda County, this data is still being maintained by our county public health department, and we do see a sharp increase here where we are at 10% positivity now, which is actually pretty consistent with what we saw on that US map. Now, what about the children? Well, we know that children are much less likely to experience severe outcomes from COVID, thankfully, but that risk is still not zero. In fact, we can see here from this data set, which we know is unfortunately incomplete, that there are deaths in the younger age groups. Now, we know that there have been over 1.13 million COVID deaths, so we can already see that this data set is incomplete because it's looking at under 1 million people. And not only is it incomplete, but age group is not available for even this incomplete data set. So all of those things being taken into account, we know this is an undercount. But even still, we have a total of 2,292 deaths in people 17 years and younger. So our 0 to 17-year-olds, we've lost over 2,000 of them in this country. And COVID is now a leading cause of death in every age group. And particularly when you consider that children are generally healthy and have decades of life ahead of them, we do not like to see any new cause of death making it into the top 10, but that is indeed what has happened. Most of the children who experience severe outcomes like hospitalization and death have underlying conditions that are very common. So we are talking about, for example, being born premature, having a history of asthma, or having obesity. So these are common things, and these are the most common underlying conditions that children with severe outcomes have. So these are important things to consider and should give us all pause. We cannot just blow this off and say, oh, it's a cold, when we know that it is having severe consequences, even when the most severe consequences are only for a relatively small subset of children. And of course, death is not the only thing we worry about. The National Institutes of Health has outlined special considerations in children, which was last updated earlier this month. It starts out by acknowledging what I think we've all been saying all along, which is that generally COVID is milder in children than adults, and that a substantial portion of children with infections are actually mild or even asymptomatic. Also, children who have one or more of these comorbidities are at risk of severe COVID, and those include heart disease, neurologic disorders. I mentioned prematurity already, diabetes and obesity, especially severe obesity, immunocompromised status, and non-white race. And we still don't have any clarity on a lot of these underlying conditions, why they make it more likely for children to have more severe outcomes. We just don't know as much in general on all the various clinical presentations of SARS-CoV-2 infection in children, just because our research has been much more extensive on adults. And when you have smaller numbers, this kind of stands to reason, but it also means that we have an even bigger blind spot when it comes to children and COVID than we do with adults. And there's a lot we don't know about adults too. The NIH special considerations also goes on to talk about MIS-C, which I'll get into more in a moment, and also into post-COVID issues that can happen after SARS-CoV-2 infection, even when that initial infection is mild or even asymptomatic. Now, you may recall multisystem inflammatory syndrome in children. We've gone over it a few times here. This is a very serious condition that can happen several weeks after the initial COVID infection, even if that initial infection was mild. This is a life-threatening condition. Here are some of the common presenting symptoms of MIS-C. If you have a child presenting with fever, abdominal pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or being very, very tired, these could indicate potential MIS-C. This is where you would want to seek medical attention right away. And again, these tend to appear weeks after that initial COVID infection. So a child can have a mild case of COVID or even no symptoms at all, and then weeks later, MIS-C can then manifest. So it's really important to stay vigilant with children. It's good for us to know if they've had COVID, and also to keep a close eye on them for the weeks following the COVID infection. So far, there have been 9,499 cases reported to the CDC of MIS-C. Now, this is reported voluntarily by each jurisdiction, so we can pretty much guess if this is not a complete data set. There have been 79 deaths reported that meet the case definition, and these are reported by the local health jurisdictions on a voluntary basis. The average age of patients with MIS-C was 9 years old, and half of the children were between 5 and 13. Now, 57% of reported cases of MIS-C where we had race data available were in children who were either Black or Latino. And we do not know why these disparities are happening. That's a pretty big disparity, major disproportionality there. We still have a lot to learn here. And we take a look at the distribution geographically, we can see that California has the most cases, followed by Texas. It's really not clear here if this has to do with more reporting or with something else. And this is yet another example of the problem with voluntary reporting of infectious diseases and relying on really a hodgepodge data system all in all. Now, we also know that children are not, unfortunately, immune to long COVID. And in fact, they appear to have an incidence of long COVID that may be similar to adults. So even though estimates definitely vary widely, about 1 in 10 children seem to have the persistent symptoms that can go along with long COVID, so about 10% like adults. We still have a lot to learn here as well. But as a reminder, and one place where we do have some good data is that children under 18 are 2.5 times more likely to be newly diagnosed with diabetes in the 30 days after COVID infection compared to those without COVID, and even compared to those that had other respiratory infections before the pandemic. So once again, this is not the flu, this is not a cold, it causes diabetes. And it causes diabetes even in our children. And the NIH page that I referred to earlier and is linked in the post goes into a bit more detail about long COVID. It notes concern about just the sheer volume of long COVID that we may be dealing with, because even if it is 1 in 10, or even if it was less than 1 in 10, there are still so many millions of COVID infections that we know that some percentage will result in long COVID. And given that our children hopefully have quite a bit of long life ahead of them, they also have plenty of opportunities for infection and reinfection. So this is something we really want to think about and we really want to work to avoid. And that is getting harder to do. As I've just reviewed, we are having an uptick. In fact, the CDC has announced that they're seeing a summertime uptick in cases and hospitalizations. So they are warning of a late summer surge. And so given that we're having what looks like a late summertime surge and schools getting ready to start soon in many parts of the country, how concerned should we be? Where I'm in California, in Oakland, California, schools are getting ready to start next week already. And given what we just talked about with the impact of COVID on children, how worried should we be that our young people are getting ready to go back to school at this time? Well, we know that schools are a very important and significant part of the community. And if there's increase in community transmission, we can expect the same to be the case at the schools. And since there's a large amount of mixing in schools, this is just more opportunity for even more transmission. And of course, many of our young people are living in multi-generational households or with folks that have immunocompromised or other underlying conditions. So all of this mixing can not only impact our students, our young people, the teachers, school administrators and staff, but also families and households where children are when they're not at school. And remember that it will probably be about 2 more months before we have an updated booster. So for many people, including vulnerable people, including at-risk children, protection from those vaccines may be wearing off, which may be of concern as we head into school. So what do we do? Well, based on all that I have reviewed, I hope it is clear that we should still be trying to avoid infection and reinfection. And of course, this is getting more challenging as people seem to be choosing to drop protection measures, despite the fact that COVID is very much still with us. And despite the fact that there's still a lot that is yet unknown, and despite the fact that there are some concerning things that can happen to people of all age groups, either in the acute phase or after. Probably the most important investment and the most important intervention that we could do is to improve indoor air quality in the schools. Our children absolutely deserve this. Our school staff, teachers absolutely deserve this. Unfortunately, we know that many schools do not have HVAC systems. And in that case, we're really relying on windows and HEPA filtration units. And I can tell you right now that one small HEPA filtration unit is not going to be sufficient for an entire classroom full of people. So this is something to take a look at if you're a parent or a teacher or a student interested in maintaining the safest environment possible. And if you really want to take it a step further, this is something you can actually assess on your own with the help of a CO2 monitor. This is something you can purchase. I went into great detail about this in some prior briefings I've linked in the post. Definitely worth taking a look at if you have concerns about ventilation, really in any indoor setting, your office, the classroom, etc. We like to see the CO2 readings nice and low if we can get them in the 400s and 500s. We don't like to see it get over 800. When it gets over 1,000, we start to get concerned. This typically means that you're not getting circulation of fresh air, and this is going to make the risk of transmission of respiratory viruses much higher. If there's no HVAC system, so no central air, opening up windows and doors it can make a really humongous difference. So we want to see those HVAC units that are sufficient for the size of the space, but also windows and doors being open can make a huge difference if you're in an area where you can do this. And this is one of the best parts, I think, of getting a CO2 monitor. It's that you can actually make these little changes, like opening up a window, and you can literally see how much that will improve the ventilation. So these are definitely things to get familiar with if you or someone you care about is going to be spending considerable amounts of time indoors with a lot of other people, as our students do in school. And of course, some of the most concerning times in school are in the lunchrooms or anywhere where there's a lot of people indoors present without masks, eating, talking, yelling, etc. And so hopefully there are options for our students to eat outside, because in most settings, this is going to be the safest way to go. Probably the most important thing is the thing that you have the most control over when you're indoors, which is wearing a mask. Students should understand the risk involved with catching COVID for themselves and for others, for their loved ones, for their teachers, for their classmates. We have found that when presented with factual information, many young people are very interested in protecting themselves, and they often have empathy and concern for others around them. Many of them will choose to protect their bodies and their brains from this infection, especially when they familiarize themselves with the information. We should refrain from allowing all of the politicization, the misinformation, and the disinformation of the pandemic to affect our children. They deserve factual information so they can be part of keeping themselves and those around them safe. I do worry that this younger generation will grow up and ask us why we didn't do more to protect them. So wearing a well-fitting mask with filtration will provide excellent protection. This could be an N95, a KN95, or a KF94. They come in different colors. They can go with your outfit. They are an important layer of protection. Note that the American Academy of Pediatrics continues to recommend face masks and states that face masks can be safely worn by all children 2 years of age and older. They state that in addition to protecting the child, the use of face masks reduces the spread of SARS-CoV-2 within schools and other community settings. American Academy of Pediatrics, this is who looks after our children and makes the recommendations to keep them safe. They provide a lot of detail. The link is in the post, but they do support making high-quality masks available and supporting children and families who choose to continue masking in school. We are still facing very low vaccination rates across the board in children. If a child has not ever had a bivalent vaccine, they are eligible for it. I discussed this in a briefing a few weeks ago and kind of walked through some of the considerations if you're thinking about getting that bivalent booster now or waiting for the monovalent coming out in the fall. But either way, if it's been more than 4, 5, 6 months since vaccination and there hasn't been any COVID infection in the meantime, then you're going to be more susceptible to infection. That's kind of wearing off at this point. It's not entirely clear, but this also may make individuals more susceptible to long COVID or post-COVID issues like the ones I've just reviewed. So whichever way you decide to go, if you're going to wait for that monovalent in the fall, then that just means between now and then being really careful, wearing those masks indoors and making sure that you have as good of indoor ventilation as possible. So we're going to stay up to date on vaccination, wear a well-fitting mask indoors, and do what you can to ensure good ventilation in the school setting. Let's just remember that children's brains and bodies are still going through critical development. We want to avoid the impacts of infection and repeat infection, especially when there are still so many unknowns. Now, despite all of our best efforts, some children will, of course, still get COVID. The majority of children who get COVID will not need outpatient treatment, but those with immunocompromise or significant underlying conditions may actually be candidates for treatment. This is something you should really discuss with your pediatrician now if you're still not sure. And please familiarize yourself with the list of underlying conditions that qualify a person for outpatient COVID treatment linked in the post. But as you can see here, there actually are treatments available for all ages. So it really is an individualized decision with your physician, but it's a decision that should be made ahead of time before we're dealing with a COVID diagnosis. In general, the initial phase of COVID can be mild, as we've discussed, or even without any symptoms at all, but it's still useful to test so that we know if a child is dealing with COVID. So if a child has symptoms or if they've been exposed, it's good to know that this is what you're dealing with. And in the event of getting COVID, we're mostly going to treat it supportively. But we're also going to keep an eye on this young person in the weeks to months after the initial infection resolves. And this is because of what I've just gone over, because of MIS-C, which can be life-threatening. So any of those symptoms, we're going to want to consult with the physician immediately. Also, because of long COVID, if a child is becoming irritable, if they're having a hard time concentrating, if they're having a hard time sleeping, if they're getting very thirsty, urinating frequently, or getting hungry or having blurry vision, these could also be pointing to a potential new onset of diabetes, which we've just said can happen in those 30 days after COVID. Asthma we can have a new onset of asthma, as I've reviewed previously here, or previously controlled asthma can get worse. So in those weeks to months after COVID, we're going to be wanting to keep a close eye on the children and make sure that they're okay and they're getting the support they need. Also, all patients who test positive for SARS-CoV-2 should have at least one follow-up conversation or visit with their primary care medical home. And this is another recommendation of the American Academy of Pediatrics. They are recommending that this encounter happen before resuming sports or physical activity, or within 2 to 4 weeks of the positive COVID test, whichever is sooner. So week after week, I've been emphasizing that if you get COVID, please rest. Do not go rushing back out to do your regular activities. The same is true for children. There's some evidence that not resting can actually lead to more prolonged COVID symptoms, but also, and especially in children, we do worry about some of the effects that can have, especially on the heart. We know that myocarditis can happen with COVID-19. We also know there's a small risk of it happening after vaccination in some age groups, but it's much more common for us to see this after an actual infection. So even asymptomatic or mild COVID infections can lead to myocarditis. And we don't want our young people going back out into vigorous exercise or into sports and exerting themselves if they had myocarditis. There's actually a whole algorithm that physicians should be following after a child has COVID to decide whether the young person can be cleared to go back to sports or exercise. They would do an exam, maybe an EKG, just depending on the presentation of their COVID, and they'll decide whether a child would need to be referred to cardiology or have any additional workup. So once again, this is something that we're going to want to take seriously. We're not blowing this off as a cold. We're staying alert. We're cautiously returning to physical activity after being cleared by a physician. I mentioned the 2.5 times increased risk of diabetes. We really don't understand enough about why this happens in some people and not others. Same thing with MIS-C, same thing with long COVID. There's a lot we don't know. We don't know how to prevent it other than not getting COVID. We don't know how to predict who's going to get it. We really don't know how to treat any of this. So all of these are good reasons to want to avoid it. You cannot get MIS-C, you cannot get long COVID, you cannot get a bad outcome of COVID if you don't get COVID in the first place. So that is going to be our first order of business, is do what we can to avoid getting infected or reinfected. And I certainly hope that all of this is a reminder to all of us that there is still a lot we do not know. We still have a lot to learn. This is still very early in the scheme of a virus that is affecting humans. And so we are still learning more every week, every day. There's something new coming out. So that is hopeful. But until then, we are really still just scratching the surface about the effects of repeat infections. We're still learning about post-COVID events and long COVID as well. What we do know is that after COVID, we're seeing increased risk of diabetes in all ages, including children, blood clots, heart attacks, strokes, memory issues. Not in everyone, but we still can't predict who. We also know that if you caught COVID once and did fine, that is not a guarantee about next time. Every infection is a new opportunity, maybe even a compounded opportunity for long COVID and post-COVID events. So please do what you can to avoid getting infected or reinfected and avoid spreading it to others. Let's keep up our best practices to prevent the spread of COVID and prevent outbreaks. Stay up to date on vaccination. Wear a high quality filtration mask like a KN95, an N95, or a KF94, especially while indoors with others. And if you're going to be indoors, make sure there's good ventilation and filtration. You can assess this with a CO2 monitor. Limit your time indoors when you can. Limit the amount of mixing that you're doing whenever possible. Gather outside. If you'll be gathering indoors, you might also consider implementing pre-gathering testing as another layer of protection. And again, if you're someone who should be treated if you catch COVID, then you should know that in advance and you should have a treatment plan. Treatment can reduce the risk of hospitalization or death by about 80% if you start it on time. And treating on time means testing on time, so know where you can get tested. If you don't feel well, please stay home and rest. Don't spread what you've got to others. If your child doesn't feel well, please keep them home from school and make sure that you test them so that we can know what's going on with them and also so that we can keep it from spreading to others, especially those who may be more vulnerable. Remember to eat a balanced diet, incorporate fruits and vegetables and whole grains. Let's avoid those sugary drinks. You may consider a multivitamin supplement. Get your blood pressure checked, your baseline labs checked, like your sugar, your cholesterol, your vitamin D. Get some regular physical activity. Unless you're sick, in that case, please get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Look forward to seeing you next Tuesday at 10 a.m.